It would seem at first glance that undernutrition and obesity are opposite sides of the same coin and not very related to one another, and that neither of these issues would be related at all to climate change. Well, this turns out to not be true at all, according to an authoritative new report. For our listeners, the title of the report is The Global Syndemic of Obesity, Undernutrition and Climate Change, the Lancet Commission Report. One of the architects of that report is Dr. William Dietz. I'm Kelly Brownell, Director of the World Food Policy Center at Duke University and Professor of Public Policy at Duke. William Dietz is the director of the Sumner Redstone Global Center for Prevention and Wellness at the Milken Institute School of Public Health at George Washington University. Prior to joining the faculty at George Washington, he directed the Division of Nutrition, Physical Activity, and Obesity at the U.S. Centers for Disease Control and Prevention. Dr. Dietz is a member of the National Academy of Medicine. Bill, thanks so much for being with us.
It's a pleasure to join you, Kelly.
So you co-chaired the Lancet Commission that produced the report we just mentioned with Boyd Swinburne from New Zealand and worked with leading experts from all around the world. And the title of the report has the word syndemic in it. Can you describe what a syndemic is?
We thought a syndemic was a relatively new concept. It was published in the Lancet in 2017, but when we went back, this concept really originated with a woman named Singer, who was in Connecticut, and in 1992 used it to describe the interaction of poverty and health. And then it went into this quiescent phase until it reemerged into these Lancet articles. And a syndemic is a combination of the words syndemic and epidemic and reflects the co-occurrence in time and place of two or more factors, which have social determinants such as economic factors or social factors or environmental factors. And we applied this to the pandemics of obesity, undernutrition, and climate change. And we named climate change a pandemic because of its breadth of impact and how widespread it was. And like the other syndemics, which were largely limited to diseases, so that, for example, the interaction of HIV, intravenous drug use, hepatitis C, and hepatocellular cancer, these epidemics, these pandemics also interact. So, for example, particularly in middle-income countries, there is a co-occurrence of obesity and undernutrition in the form of stunting. Meat production causes obesity, colorectal cancer, and cardiovascular disease, and also generates a lot of greenhouse gases. In fact, agriculture generates almost 30% of greenhouse gases, and cattle production generates about over half of that. Another example of the interaction is between car use, inactivity, and obesity. So car use displaces physical activity, therefore increases the likelihood of obesity, generates greenhouse gases, which then in turn promote undernutrition by virtue of the catastrophic effects of excess greenhouse gases on low and middle income countries in terms of drought or even in terms of changing the nutrient composition of foods as global warming projects and moves forward. So we see these three pandemics as huge challenges and ones which are the paramount challenges for the 21st century.
So your report discusses using a systems approach to understanding and addressing these problems. What is a systems approach, and what systems in particular do you think will be influential in changing the intersection of these things?
Well, so I indicated from these examples of interactions, they're really systems that underpin undernutrition, obesity, and climate change. And the most prominent systems are the agricultural system, the urban design, land use, and transport systems. But even deeper than those systems are the underlying drivers of those systems. So the question becomes, why do these systems operate the way they do? Well, they operate the way they do because we've designed them that way. The reason that we are car use dependent is not only because cars are heavily promoted by business and particularly on television, but car use is sustained by community design, which is not designed for public transport. It's designed for car use, and promoted by the lack of taxes on gasoline or the low taxes, which haven't been increased in years. So we're not paying the true costs of transport, and we're not paying the true costs of beef production, for example. The same thing applies to meat production. So subsidies for forage crops support beef production and keep the prices artificially low. And we don't pay then for the greenhouse gas emissions by cattle. We don't pay for the environmental degradation caused by concentrated animal feedlots. If we were to pay the true costs of transport or the true costs of food production, I think we would see substantial shifts in the consumption of our use, for example, or meat consumption. And this systems approach allows us to begin to point out what we've called double and triple duty actions, that is, strategies which affect two or more of these pandemics. So increasing the gas price is one of those triple duty actions. Reducing meat consumption is one of those triple duty actions, which affects not only obesity, but also climate change and undernutrition.
Bill, you're making a pretty radical proposal that people pay the actual cost of these things. So, for example, if you go to the store and buy hamburger or a steak, the cost could go way the heck up, couldn't it, if you're paying for the health consequences that these products produce in the society and the environmental consequence? Do you have any reason to believe the public would accept such a thing, or that politicians would even propose it?
Well, that's a good question. We talk in the report about policy inertia, which is a term we coined to reflect the lack of movement on any of these issues, despite widespread recommendations that changes occur. And policy inertia, as you correctly point out, is a consequence of lack of political will, lack of public demand, and industry opposition. So there's good evidence of industry opposition, the most recent of which was to the Dietary Guidelines Committee report that most recently appeared. The Dietary Guidelines Expert Committee recommended more movement towards a plant-based diet, which was met with substantial opposition by the meat industry and the National Cattlemen's Association. I think there's a National Meat Institute and one other organization, which indicates the kind of resistance to these types of changes, despite the fact that these changes would improve both health and the environment. So the bottom line here is I don't think we can expect government to act unless we begin to change things at the local level. I really have come to believe that if this is going to happen, it's going to happen because people change their behaviors and begin to push governments to change their policies. And I think we can point to things that are already happening, moving in that direction. Meatless Monday is one of those examples. We know that the growth of products which are produced sustainably is increasing at about 5% a year. That's huge. We know that businesses that are selling healthier for you or better for you products are seeing more rapid increases in the sales of those products than in their traditional product lines. We also know that that cities, despite the U.S. withdrawal from the Paris Accords regarding climate change, that a number of U.S. cities have persisted in trying to reduce their carbon footprint. And these trends are underway. Whether they're going to be powerful enough or operate quickly enough to reverse the global syndemic remains to be seen. But I'm worried because we don't have very much time left. And these behaviors that are starting locally need to be amplified, and we need to be able to change the governance systems which underpin the systems that we have.
So, Bill, you mentioned that the U.S. was out of step with the rest of the world on things like climate accord, and there's just a lot of examples of this kind of thing. And so I'm assuming that in the U.S., business interests are prevailing over public health interests more than in other countries. One has to wonder whether there's any hope of reversing that. And you mentioned some local actions might eventually percolate up and affect the national government. Are there precedents for this that you've seen in other areas that might make you optimistic?
Well, I'm optimistic around the ability of people to change and governments to change. So take soda taxes. There are about 7 or 8 cities now or municipalities which have implemented soda taxes. And internationally, there's actually more progress around soda taxes than there is in the United States. There are almost 30 countries which have implemented soda taxes. Mexico is a really good example. And what happened in Mexico was that civil society, that the consumer groups, really went to bat for the soda tax, despite very substantial opposition, which is why in our report, one of our recommendations is a call for investment, a $1 billion fund that can be used to support civil society actions in about 100 different countries. The other thing that we call for, which I think is implicit on what I mentioned just a few minutes ago, is that a summit of businesses who are operating based on principles for the 21st century. And those principles are matching profit with health of the community and health of the planet. And the corporations that have begun to do that, I think, are much more likely to succeed. And a summit of those activities, or a summit which calls together businesses designed for the 21st century, I think would be very instructive and perhaps create models that would spread.
Do you see the world of philanthropy and foundations being helpful in moving these things forward?
Absolutely. For example, the Bloomberg Foundation was instrumental in working in Mexico and is now invested in a number of other Latin American countries. And I think that innovation often starts, at least in the U.S., with foundation support. Interestingly enough, we were not able to get foundation support for our initial work on the syndemic, so that one group which was working on undernutrition recognized the association of undernutrition with obesity, but said, we're very interested in undernutrition, not obesity. One of the groups working on climate change recognized the effects of climate change on undernutrition, but said, we're interested in climate change, but not undernutrition. So hopefully the recognition that this global syndemic exists will also prompt foundation investments to do the necessary work around communication, convening, all of the kinds of things that our recommendations called for, including a framework convention on food systems analogous to the framework on tobacco control.
So, Bill, for our listeners, the title of the report that we've been speaking about is The Global Syndemic of Obesity, Undernutrition and Climate Change, the Lancet Commission Report. How could people get access to that report?
The report's available online. If you go to the Lancet and just search for the global syndemic, this will come up.
Well, thank you so much for joining us. This is a landmark report, I think, in a lot of ways. It helps bring together obesity, undernutrition, and climate change, which hasn't been done in a systematic way as this report did it. And I think it could ultimately help mobilize a lot of parties to work together who otherwise weren't thinking of doing so. So congratulations for this, and thank you for your important work in the field and for joining us today.
Well, thanks, Kelly. Nice talking to you. Thanks for the opportunity.
Our guest has been Dr. William Dietz, director of the Sumner Redstone Global Center for Prevention and Wellness at the Milken Institute School of Public Health at George Washington University. And thank you to our listeners. Please subscribe to the Leading Voices in Food at Google Play, Stitcher, Radio Public, or Apple Podcasts, or by visiting our website at the Duke World Food Policy Center. This is Kelly Brownell.